Welcome to LPN LaunchPad's review of the upper and lower peripheral vascular system assessment. This review focuses on inspection, palpation, and auscultation techniques for evaluating the peripheral vascular system. The objectives are to understand assessment techniques, recognize abnormal findings, and link these findings to clinical conditions. The overview includes inspection, palpation, auscultation, and additional observations. Inspection addresses skin, hair, and edema. Palpation focuses on temperature, capillary refill, and pulses. Auscultation detects bruits. Additional observations identify arterial or venous issues and neuropathy. Observe the skin for color, texture, moisture, and visible lesions. These characteristics reveal important circulatory and systemic information. Recognize that pallor suggests poor blood flow or anemia. Cyanosis indicates poor oxygenation. Erythema suggests inflammation or infection, and jaundice may indicate liver dysfunction. Assess hair growth on the arms and legs. Patchy or absent hair often indicates poor circulation or peripheral artery disease. Examine for swelling, especially in the lower extremities, because edema frequently indicates circulatory problems. Differentiate pitting edema, in which an indentation remains after pressure, from non-pitting edema, where swelling lacks indentation. Identify that unilateral edema may indicate deep vein thrombosis, while bilateral edema may indicate heart failure, kidney disease, or venous insufficiency. Use the 4-grade scale. 1 plus is a 2 millimeter depression with immediate rebound. 2 plus is a 4 millimeter depression that rebounds in 10 to 15 seconds. 3 plus is a 6 millimeter depression lasting 30 seconds to 1 minute. And 4 plus is an 8 millimeter depression persisting 2 to 5 minutes. Palpate the skin with the back of the hand and compare temperatures between limbs to identify circulatory abnormalities. Recognize that cool extremities suggest arterial insufficiency, while warm skin may indicate infection or inflammation. Both guide clinical decisions. Press on the nail bed until blanching occurs, then release to observe the return of color, which provides a rapid assessment of peripheral perfusion. Note that a normal refill is less than 3 seconds, while a delay of more than 5 seconds may indicate poor circulation, dehydration, or peripheral vascular disease. Assess the radial pulse at the thumb side of the wrist, the ulnar pulse at the little finger side, and the brachial pulse in the antecubital fossa, recording pulse quality and rate. Palpate the femoral pulse in the groin and the popliteal pulse behind the knee, evaluating arterial flow to the lower limbs. Assess the posterior tibial pulse behind the inner ankle and the dorsalis pedis pulse on top of the foot, comparing pulse strength between these sites. Use the scale. 0 is absent, 1 plus is thready, 2 plus is weak, 3 plus is normal, and 4 plus is bounding, which may indicate fluid overload or hypertension. Absent or weak pulses suggest arterial occlusion or peripheral artery disease, while bounding pulses may indicate hyperthyroidism, fever, or increased cardiac output. Use the stethoscope's bell to listen over major arteries, such as the femoral artery, for sounds of turbulent blood flow. Recognize that bruits indicate turbulent blood flow, often caused by atherosclerosis or aneurysm, warranting further investigation. Look for ischemia, which indicates reduced oxygen supply, embolism, which indicates complete blockage, and atherosclerosis, which may present as intermittent claudication or leg pain. Observe for varicose veins and dependent edema in the feet, legs, scrotum, or sacral region. Note any skin discoloration or non-pitting edema, which can help distinguish venous insufficiency. Test sensation by having the patient close their eyes and lightly touch their toes. Loss of sensation may indicate nerve damage commonly associated with diabetes or peripheral artery disease. Inspection focuses on skin, hair, and edema. Palpation evaluates temperature, capillary refill, and pulses. Auscultation detects bruits. And additional observations identify arterial and venous issues and neuropathy. Early detection enables timely intervention and assists in diagnosing conditions such as peripheral artery disease, deep vein thrombosis, and chronic venous insufficiency. Prioritize circulatory status, no pulse grading, differentiate edema causes, recognize that bruits indicate turbulence, observe capillary refill, and distinguish between arterial and venous disorders for exam success. Assess for pallor, cyanosis, and temperature changes. Cool, pale, or discolored skin is a sign of vascular compromise. Recall that 0 indicates absent, 1 plus indicates thready, 2 plus indicates weak, 3 plus indicates normal, and 4 plus indicates bounding. Note that peripheral artery disease often presents with weak pulses, while hyperthyroidism may present with bounding pulses. Unilateral edema often indicates deep vein thrombosis, while bilateral edema may be linked to heart failure or kidney disease. Identify whether the edema is pitting or non-pitting to determine the circulatory issue. Use the stethoscope bell over major arteries, recognizing that bruits often indicate atherosclerosis or aneurysms, requiring prompt attention. Note that a normal refill is under 3 seconds, while a delay beyond 5 seconds suggests a circulatory compromise, which may result from peripheral artery disease, dehydration, or shock. Understand that arterial insufficiency often presents with cool, pale skin, weak pulses, and intermittent claudication, whereas venous insufficiency presents with warm, swollen extremities, varicose veins, and brown discoloration. Consider the following question. A nurse notices bluish discoloration on the patient's lower extremities during a peripheral vascular assessment. Does this indicate pallor, cystosis, erythema, or jaundice? The correct answer is B, cyanosis, which indicates poor blood oxygenation and suggests reduced tissue oxygen delivery. Consider the following question. While assessing a patient's lower extremities, a nurse observes pitting edema with an indentation lasting 30 seconds to 1 minute. What is the edema grading? A, 1 plus, B, 2 plus, C, 3 plus, or D, 4 plus? The correct answer is C, 3 plus. The definition of 3 plus edema is a 6 millimeter depression that persists for 30 seconds to 1 minute and indicates moderate edema severity. Consider the following question. A nurse detects a bounding peripheral pulse. Which condition is most likely associated with A, arterial occlusion, B, peripheral artery disease, C, hyperthyroidism, or D, deep vein thrombosis? The correct answer is C, hyperthyroidism. Hyperthyroidism frequently causes increased cardiac output, which is the cause of bounding peripheral pulse. Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.